Pneumonia. It's a word that can strike fear into the hearts of many, yet its true danger often lurks beneath the surface, often ignored until it's too late. This silent epidemic claims millions of lives each year. Pneumonia is not just a bad cold but a serious infection demanding our attention. The World Health Organization highlights pneumonia as a leading cause of death worldwide. It's time to shed light on this deadly infection and empower individuals with knowledge. Pneumonia is an infection that targets the lungs, vital organs drawing oxygen into our bodies. Imagine your lungs as intricate networks of air sacs, like tiny balloons inflating with each breath. Pneumonia inflames these air sacs, filling them with fluid and disrupting oxygen exchange. Symptoms can range from mild to life-threatening, depending on the germ and the individual's health. Pneumonia is not a one-size-fits-all disease. It manifests in various forms, each with its own characteristics and challenges. Understanding these different types is crucial for effective prevention and treatment. Bacteria, viruses, and fungi are among the culprits that can trigger pneumonia. Bacterial pneumonia, often caused by Streptococcus pneumonia, is a common and potentially serious form of the infection. Viral pneumonia, frequently linked to influenza, can be equally concerning, especially for those with weakened immune systems. Fungal pneumonia, while less common, poses a significant threat to individuals with compromised immunity. While pneumonia can affect anyone, certain groups are particularly susceptible to its severe consequences. Infants and young children, whose immune systems are still developing, are at a higher risk of contracting and experiencing complications from pneumonia. Older adults, especially those with underlying health conditions, also face an elevated risk. Individuals with weakened immune systems, such as those undergoing chemotherapy or living with HIV/AIDS, are particularly vulnerable to pneumonia. People with chronic illnesses such as heart disease, lung disease, or diabetes are also more likely to develop serious complications from pneumonia. Section 5. Recognizing the warning signs, common symptoms of pneumonia. Early detection is crucial in the fight against pneumonia. Common symptoms include a persistent cough with phlegm, fever and chills are also common. Shortness of breath is a red flag. Chest pain can signal pneumonia. Seek medical attention promptly. Section 6. The silent killer, why pneumonia can be fatal. Pneumonia's danger lies not only in its ability to attack the lungs but also in its potential to trigger a cascade of life-threatening complications. One of the most concerning complications is sepsis, a life-threatening condition that occurs when the body's immune system overreacts to infection, leading to widespread inflammation and organ damage. Acute respiratory distress syndrome, or ARDS, is another serious complication of pneumonia, characterized by severe inflammation and fluid buildup in the lungs, making breathing extremely difficult. Pneumonia can also exacerbate existing health conditions, such as heart failure and chronic obstructive pulmonary disease, leading to further complications. Section 7. A global health crisis. Pneumonia's impact worldwide. Pneumonia's reach extends far beyond individual cases, impacting global health on a massive scale. According to the World Health Organization, pneumonia is responsible for millions of deaths each year, particularly in low-income countries where access to healthcare and preventative measures may be limited. Children under the age of 5 are disproportionately affected, highlighting the urgent need for increased vaccination efforts and improved access to healthcare in resource-limited settings. The economic burden of pneumonia is also significant, as it leads to lost productivity, increased healthcare costs, and strain on already stretched healthcare systems. Section 8. Shielding ourselves, prevention strategies for pneumonia. While pneumonia can be a formidable foe, we are not powerless against it. A combination of preventative measures, including vaccination, good hygiene practices, and lifestyle modifications, can significantly reduce the risk of contracting this potentially deadly infection. Vaccination is a cornerstone of pneumonia prevention, particularly for vulnerable populations such as infants, young children, and older adults. Vaccines against pneumococcal bacteria, a common cause of pneumonia, are highly effective in preventing severe cases and complications. Section 9. Combating the infection treatment options for pneumonia. Timely and appropriate treatment is critical for overcoming pneumonia and preventing long-term complications. The type of treatment prescribed depends on the cause of the infection, the severity of the illness, and the individual's overall health. For bacterial pneumonia, antibiotics are the mainstay of treatment, targeting and eliminating the bacteria responsible for the infection. Viral pneumonia, on the other hand, is typically managed with supportive care, such as rest, fluids and medications to relieve symptoms like fever and cough. In severe cases, hospitalization may be necessary to provide respiratory support, such as oxygen therapy or mechanical ventilation to assist breathing. Section 10. Challenges on the horizon. The fight against pneumonia continues. While significant strides have been made in understanding, preventing, and treating pneumonia, challenges remain in our fight against this global health threat. One of the most pressing concerns is the rise of antibiotic resistance, as bacteria evolve and develop mechanisms to evade the effects of these life-saving drugs. Climate change also poses a challenge, as changes in weather patterns and air quality can exacerbate respiratory illnesses like pneumonia. Addressing these challenges requires a multifaceted approach, including research and development of new antibiotics, strengthening infection control measures, and promoting global health equity. Section 11. A call to action, protecting ourselves and future generations. Pneumonia is a global health crisis that demands our attention and action. By raising awareness about this often ignored infection, we can empower individuals to protect themselves and their loved ones. Early recognition of symptoms and prompt medical attention are crucial for improving outcomes and reducing the burden of this deadly disease. Let us work together to advocate for increased research, improved access to healthcare, and strengthen public health initiatives to combat pneumonia and safeguard the health of current and future generations.